One of the most difficult parts of sperm donation is choosing your donor and determining which type of sperm preparation to order. To help recipients, PST offers an extensive online donor profile with complimentary childhood and adult photographs and relevant findings from the various health screens completed by the donor. Donor choice is a very personal decision and may be informed by race or ethnic background, education, appearance, a favorite movie, or other characteristics. From a health and safety standpoint, rest assured that any PST donor you choose has undergone and passed rigorous medical, genetic, psychological, and infectious disease screening. In fact, before releasing sperm to recipients, it must be quarantined for 6 months. Quarantine means that sperm must be frozen and kept stored at the sperm bank for at least 6 months to allow the donor to return for repeat infectious disease tests. Quarantine is an effective method for lowering the risk of infectious disease transmission. Donors also undergo extensive genetic screening and counseling. Donors are tested using a carrier screen of over 500 genes, followed by genetic consultation with a certified genetic counselor. The carrier screening results and other significant hereditary risks identified by the genetic counselor are available as part of the online donor profile. PST strongly recommends all recipients seek genetic consultation with a certified genetic counselor to assure genetic compatibility with the donor. Blood type is not a significant risk factor when choosing a sperm donor, similar to when women choose their male partners without knowing blood type. The one exception being Rh-negative women who choose an Rh-positive donor. In these cases, women may need an injection of immune globulin while pregnant to prevent endangering future pregnancies. Blood type inheritance is complex, and it should be remembered that children may not always inherit the exact blood type of their biological parents. Which type of sperm donation should you order? Well, that depends on the type of insemination that is planned. Women undergoing insemination at a clinic should use washed sperm prepared for intrauterine insemination, also known as IUI. Sperm needs to be washed before IUI as prostaglandins must be removed from the semen to avoid severe cramping or discomfort. Women undergoing insemination at home typically use unwashed sperm for intracervical insemination, also known as ICI. PST offers vials containing 5 million and 10 million motile sperm. Women undergoing IUI in a clinic can use vials containing either 5 million or 10 million motile sperm, but should first check with their medical professional. Women undergoing home insemination with ICI should perform 2 inseminations, the first within 12 hours of a positive LH surge and the second 24 hours later. Studies indicate higher pregnancy rates when sperm is introduced at least twice during the fertile window. Women undergoing IVF can use either unwashed ICI sperm or washed IUI sperm, but should first check with their fertility specialist before ordering.